Feeling stuck in the clinic? You're not alone. The burnout is real, the shifts are long, and the pressure is mounting. But your clinical skills have a massive second life in digital health. The landscape of medicine is changing faster than ever before. With the rise of AI and global health tech, clinicians are the missing link in the next wave of innovation. In this masterclass, we are going deep into the 5 powerful paths you can take right now to transition your career from the front line to the digital frontier. Let's get started. By 2026, the digital health market will exceed $500 billion. This isn't just a trend. It's a fundamental shift in how healthcare is delivered, managed, and funded globally. Governments and private sectors are pouring billions into digital transformation. However, they lack the clinical leadership and insight needed to guide these new tools safely and effectively. That's where you come in. Your clinical experience is the most valuable asset in the room when designing and implementing new health technology. You understand the workflow like no one else. Path 1 is clinical informatics. This is the bedrock of digital health. It is the field where clinical practice meets the science of data, information, and the systems that power hospitals. In this role, you aren't just using systems, you are redesigning them. You're making sure templates, alerts, and workflows actually work for clinicians, not against them, saving precious time. You'll be at the forefront of implementing AI scribes and automated documentation workflows that have the potential to slash the hours spent on paperwork, bringing the joy back to medicine. This path is perfect if you're analytical, detail-focused, and love solving the why behind clunky clinical processes. If data errors and bad workflows frustrate you, this is your home. Salaries in this field are competitive. In the US, entry-level roles start around $120,000, while senior informaticists can easily command over $180,000. Path 2 is transformation and implementation. This is for the clinicians who love leading people and managing complex change. This role is about making sure technology works in the real world. You might lead the rollout of virtual wards, hospital-at-home programs, or remote patient monitoring. Your success is measured by how well the clinical team actually adopts and uses the technology. A massive part of this role is education. You are a coach and a mentor, helping your colleagues overcome their fears and technical hurdles to feel confident in a digital-first medical environment. If you enjoy organizing chaos, leading teams, and seeing a complex system finally click into place, this is your calling. You are the bridge that turns a tech purchase into clinical success. Path 3 takes you into the heart of the tech industry. This is where innovation moves at the speed of light. From startups to big tech giants, clinicians are in massive demand. Tech companies need clinicians to help build their products. You'll be the voice of the customer, ensuring that the tools being built are actually useful, safe, and intuitive for frontline use. You'll help bridge the massive language gap between medical speak and tech speak. You'll translate clinical needs into technical requirements, making sure engineers build what clinicians need. The culture here is vastly different from the hospital. It's often remote-friendly, fast-paced, and highly innovative. It's perfect for the entrepreneurial mind who wants to reach millions. Path 4 is safety, governance, and risk. This is one of the most critical roles in the entire ecosystem. As technology becomes more autonomous, safety becomes the priority. As a clinical safety officer, you are the guardian. You ensure that new digital tools and AI models don't inadvertently harm patients. You are the final check before any system goes live. You'll become an expert in regulatory frameworks like DCB 0129. You'll audit AI models for bias and ensure that ethical tech deployment remains at the heart of the industry. If you are meticulous, risk-aware, and care deeply about ethics, this path allows you to safeguard millions of patients in the digital world. Your work saves lives on a massive scale. Finally, Path 5, strategic leadership. These are the top-tier, C-suite roles shaping the future of entire healthcare systems, regions, and sometimes even national health policies. Roles like the CMIO or CCIO bridge the gap between clinical needs and executive strategy at the boardroom table, influencing multi-million-dollar budgets and roadmaps. This path is about long-term vision. You aren't just managing one project. You are deciding the entire technological roadmap for a health system, ensuring it aligns with patient care goals. You'll need a strategic mind, political savvy, and the ability to influence C-suite decisions. It's a high-impact role that shapes the future of medicine for entire populations. But how do you transition? You need to bridge the skills gap. While clinical experience is your base, you need to add a layer of tech literacy to be taken seriously. Networking is vital. Most digital health roles are filled through connections. Your goal is to become a known quantity in this small but rapidly growing community of professionals. You don't need to learn to code, but you do need to understand data structures, AI ethics, and agile project management to effectively communicate with your new tech colleagues. The future of healthcare is AI-powered. We are entering an era where generative AI will automate the administrative burdens that lead to clinician burnout, allowing you to focus on human care. Remember, digital health is a global field. The skills you learn are transferable across the world, from the NHS to the private markets in the US, Europe, and Asia. Your career has no borders. When you land your first role, have a strategy for the first 90 days. Your priority should be listening and learning. Understand the culture and the technical stack before you try to change it. Which path calls to you? Whether it's the data of informatics or the innovation of industry, your clinical experience is the key to unlocking a rewarding digital future. Don't wait for the perfect time. Start today. Head over to rodgamble.com to grab my free self-assessment guide and map your journey into the world of digital health. Your career in digital health starts now. Like this video? Drop a comment with your questions, and I'll see you in the next one as we build the future of medicine together.